Well, the NHS is so critical to everybody in society, and I think it's really important we get a more nuanced debate that doesn't fall into the trap of either demonising the NHS or portraying it as if it's all run by angels, because the reality is the NHS matters to every single one of us. At some point in our lives we will need the NHS, or our family member will. And it's really important. We own the NHS, the public own the NHS, so I'm delighted that people want to come and turn out and talk about it.
Well, it's very important that we have a healthy city and a healthy city for all. And we've got extreme health inequalities across this city. And I think that's a matter of us bringing together all our expertise right across the city. And this is both physical and mental health, to make sure that we are pooling our resources and thinking about prevention before cure. We operate as one city, and we should operate as one city, and I think we've been in the past operating in silos, where you spend in one silo and it has an effect on another, but it doesn't benefit the spending one. So I think it's really important that we break down the barriers between the various interests in the health community.
I work in a World Health Organization Healthy Cities Centre, and we support cities around the world in linking city development, communities and health, but not through healthcare, through how the environment in which people live, work, play, learn supports their health. I've just come from a session where we're talking about healthy communities and healthy cities. It's been a very stimulating debate. Absolutely amazing, really, to have the wealth of experience of the audience in the room, and coming really to the position or the outcome that neighbourhood involvement, participation will link people's health and well-being. This event's really important because it gives a time for both sort of academics, politicians, people involved in projects to be sort of to part of the debate with people who are interested in hearing more about projects, and also the people, the so-called experts on the podium, being exposed to what people think in the city and other things that are going on. I think this event has really opened up some new thinking, both for the audience and for all the panel members.
I'm from an organisation called Happy City, which is here to try and help people in individuals, communities and cities focus much more on well-being and how we can create cities that are focused on helping people to flourish in their lives. I think events like today are really, really important because there are very few things that are as complex, either as health or as how you organise a city. They're very, very complex systems that have lots and lots of different crossovers. And I think it's really, really important that we do more of that piece where we bring people from very different perspectives around those things together to explore what's working, what's not working, and how we move forward in a different way. And I think what we've managed to do in some small ways today, but I hope that will have knock-on effects in bigger ways, is to try and knit up some of those pieces. Is health just about who goes to the GP? Is health about how we physically build our cities? Is health about the importance of green spaces and nature? How do we those are conversations that happen in very, very different places and spaces across a city. And the experience of that, if you're a citizen in one part of the city, or if you're a policymaker in another, or if you're a business person somewhere else, are very different and can feel very, very separate and disconnected. And I think by having these sorts of conversations, we help bring those conversations together, we help bring those ideas together and help be much more holistic in the way that we think about what it means to design and build and create and support communities in our cities that can really, really help people to thrive, both physically, mentally, emotionally and socially. And that's what I'm excited about for today.
I'm a consultant psychiatrist and clinical director for mental health services in Bristol. I'm really excited actually to have this opportunity to be here today. It's been a fantastic session exploring the debate around mental health and the determinants of mental health, good mental health, and also how we respond to that as a community. I really thought that the discussions that we unpacked with the audience today got to the heart of some of the key issues, which are thinking of mental health provision as broader than simply something that is commissioned as part of the health service, that the determinants of good health, the communities we live in, the way that we are connected or not connected, as is the case with many of our communities in Bristol, are key, and that we need to be thinking at strategic and operational levels in order to derive the outcomes we're looking for. I thought it was a fantastic mix of engagement with different questions coming from service users, from people with a strategic or media experience, and they were really getting to the heart of what it is that we're trying to achieve going forwards. Thought it was great, love to come back. I think it'd be great to do these on a very regular basis.
I love these kind of events, and I think it is important to sometimes just discuss ideas. I think it will build a platform for doing everything, but things always begin with ideas. And one of the things that frustrates me is when people dive into activity without really thinking about what we mean by the challenges we're describing, how we understand them, how different people approach them. We could just dive into the issue of mental health without, as we have done today, beginning to look at the complexity of society, social inequality, the position it plays in the economy, in education, in employment, and so forth. So it's absolutely critical that Bristol is a place that discusses ideas, that knows what it thinks and knows why it thinks it, and actually has space for thinking about things differently. And we give space to that difference of worldview. And we know the evidence tells us that it's having a diversity of thought at the table that produces greater ideas. So it's really important that we create these spaces to really kind of harvest, to unearth that diversity of thought. And so yeah, for me, it's fantastic to be at the table. It's fantastic to be able to test my own thinking and to share my thoughts and have them really push back at me. Sometimes to be told I'm wrong.
I'm Chief Exec at Bristol Community Health, and we're providing services across the community. Our nurses and therapists working in people's homes alongside carers. So the session today, do we have a caring society, is really relevant for us. Are we caring enough? Are we able to care enough? Do we get enough time to care? And how do we work with carers and families around a patient that we're looking after? So really worthwhile to enter into the debate and think about that today. Okay, so I really wanted to come and participate. It's part of having a dialogue with real people, which isn't something that you can always do in the course of the working day. So I'm able to take away ideas, get a real reality check, get my feet on the ground and actually just stimulate some ideas for doing things differently in my day job.
I am the Vice Chair of Bristol Parent Carers and a parent of a child with disabilities here in Bristol. And I think today is really important because it gives an opportunity for people to say what's bothering them and to actually be honest about their situations. But also it's important because big changes are started with tiny steps, really. So if somebody goes away from here and thinks differently about how to care for their mother, or I set up a meeting that enables a family to get care that they otherwise wouldn't have been able to access, those are small changes that could go on to start something really, really big and important.
Well, I think we've had a great event, and the reason we went ahead and planned this is because health is on everybody's agenda. Everyone's interested in health, everyone's concerned for themselves, their families and friends. And you hear an awful lot about health in the media, and it's often a very brief, sensational description of something. Something hasn't worked, something's been a problem, occasionally something's gone well. But what you very rarely get is decent, informed debate where you can hear from a series of experts, where you have the chance to ask questions and maybe kick a few ideas around. And I think we've achieved that. That's what we set out to achieve. And hopefully people will go away feeling a little bit more informed about health services and care services.
So I've worked in the NHS for most of the last 20 years and I'm now hoping to become a politician representing people of South Bristol. And for me, the quality and the level of debate around the NHS is being quite poor. There's a lot of platitudes talking about, but actually really getting into the details and the issues and really involving patients and the public as citizens in what sort of health service they want to see and what sort of health and social care system is really what motivates me politically. So I was delighted when the Bristol Festival of Ideas decided to have a 2-day event on this, because I think to start to open up the public debate about what sort of system we want to see is one of the most important issues facing us. We know that the health service is second on people's priority list of things they worry about. So it's been a great couple of days and I'm really glad to be part of it.
I'm a doctor and an entrepreneur. I set up a company 6 years ago in order to change the way we use technology in healthcare to drive efficiency and safety gains. We set the company up in Bristol. I was invited here today as a panellist to talk about the use of technology to drive efficiency and safety gains in healthcare. It's important because it's not often that you actually be able to engage directly with the general public, share your views, debate the real critical issues that face the health service locally here in Bristol and nationally.
I thought it was a fantastic event. It's really great to see so many people willing to come out and participate in this sort of event over a weekend. And I thought we had really good contributions from the audience and a really good level of debate about some important topics. It was interesting to see just how much unanimity there was around the problems and the opportunities and the solutions, but understanding just how difficult it was to implement those things. But I think the willingness of the public, as represented today, to get engaged in some of those big picture issues was really very encouraging and shows that we should I think spend a bit more time trying to make sure that we involve them in everything we do.
My observations are, based on a personal perspective, is that it's absolutely fundamental that people engage in the change that the NHS is going to have to face in the future. I work in a range of different health and social care economies, and it's really clear to me that people need to be front and centre in their views. They need to make these views heard. They need to understand what changes could be put forward, whether it's in terms of primary care, community hospitals, etc., and really retain an ownership of the NHS for us and for our families.
We ran this event in partnership with the Festival of Ideas in order to open up some big discussions about the health and care system in our city, the current challenges we're all facing together and some of the choices we've got to make for the future. Above all, though, it was an attempt to really get the public involved in the discussion in a way which we maybe haven't managed to date, and I'm really pleased with both the range of contributions from a whole range of people, from the Mayor to local commissioners, to representatives of local carers, to people running big trusts up and down the country. Lots and lots of ideas about the issues that we face and how we can start to tackle them. Lots of challenges though, but I think what's been great about this last few days is that some of those are now out in the open, maybe in a more explicit way, and in a way which the people of the city are more engaged in, hopefully, than they were a couple of days before. And my open invitation is for people to continue that engagement by getting in touch, helping to shape our agenda, because ultimately what's important is that the people of the city, as well as the professionals in the health system, are involved in discussing change and what that's going to look like.